Hi, my name is Ruchen Qu. I'm one of the third-year nursing students. Today, I would like to talk about my clinical experience and how it aligns with the selection criteria. About the first question, during my clinical placement, I care for a patient with a history of multiple suicidal attempts. He feel very upset about his transfer plan to mental health ward. I approach him calmly and ask if he would like a cup of tea. I sat with him and listened without interpreting. I remain respectful, adjust my tone and pace, and use simple, supportive language to build rapport, such as I know it must be really hard for you to be through all of this. After he opened up, I escalated his emotional concern to my preceptor Ryan, so the team could review the transfer decision. As a result, the patient became more cooperative and calm. I also documented his emotional changes and our conversation in the progress note to ensure continuity of care. This experience taught me the importance of empathy, active listening, and timely communication in delivering person-centered care. After I made a medical error, my first action would be to do a A2E assessment on the patient to make sure there's no immediate adverse effect. Then, I would report the incident to my team leader and follow the correct incident reporting procedure according to hospital protocol, including completing documentation honestly and promptly. Depending on the situation, I will also inform the medical officers. To prevent errors, I always follow the 10 rights of medication administrations. I'll always check 3 identification, name, date of birth, and MRN number. And I make sure I understand why the medication has been charted rather than just give them according to the medical chart. For example, I will check the patient's blood pressure before giving antihypertensive and ask the patient if he has opened the valve before I give Movicol. I always work in a safe environment with safe staffing levels where I can concentrate and ask for help when unsure. Patient safety is always my top priority, and I value transparency and accountability in all aspects of medication administration. Third, about managing high acuity workload. It is very common to come across busy shifts, and it is important to maintain our priority when it comes across them. When managing a shift with high acuity patient, I stay focused by assessing clinical urgency and prioritize tasks accordingly. I divide tasks into manageable steps and delegate when appropriate. I use e-spot handover to communicate with multidisciplinary team clearly and efficiently. I also monitor my own stress level. For example, I won't hesitate to ask for help from my body nurse and team leader, especially when I feel overwhelmed. This ensures patient safety and also protect my own well-being, because you don't want to burn out, especially in a high-pressure environment. During my lunchtime, I take short mental breaks when safe to do so, and a debrief after challenging shifts. Teamwork and open communication help me stay grounded and effective even under stress. The fourth question is about NSQHS and WHS understanding. Understand that the NSQHS standard from the foundation of safe and high-quality patient care. I constantly apply infection prevention and control principles. For example, I perform proper hand hygiene, wear correct PPE, and ensure accurate documentation for safe handovers. One of the most basic yet essential practices I have learned is maintaining a safe and prepared clinical environment. For example, when preparing for an injection, always keep the sharp container within arm reach to dispose of the needle immediately after use. I also carry alcohol wipes with me all the time so I can maintain aseptic technique whenever care is delivered. In terms of WHS, I conduct quick environmental checks for hazards such as spills or faulty equipment and report them promptly. I use safe manual handling techniques and equipment like stack sheet or jack collet to prevent injury. Though these tasks may seem small, I've come to understand that these constant habits are crucial for maintaining both patient and staff safety. The last question is about contributing to a positive patient experience using CHS values. During my placement in ward. I care for a couple. They both living with dementia. The wives have compulsive behavior, such as going to the toilet every 10 minutes or tidying up her bed sheets all day. At least I try to stand by assist, as per the handover said, thinking it will keep her safe. But her husband became visibly upset and asked me to leave her alone after one time I tried to approach her. I respect his concern and adjust my approach to observation only when she is in the room. Later, he apologized to me and said his wife would become stressed out when someone interpret and distract her routine. And thank him for sharing this. And I know it's important to not only express our reliability but also show our respect to the patient's willing.